Ever wondered why patients with lupus can suddenly develop chest pain that mimics a heart attack, but their coronary arteries are totally fine? This isn't a trick. It's a classic example of lupus-induced pericarditis. Rheumatologic diseases aren't just about joints. They affect every organ system, and if you're in med school, you need to understand how. In the Brigham Board Review and Comprehensive Update in Rheumatology 2022, top-tier faculty break down these complex cases with a focus on clinical application, exactly what boards and real life demand. Let's quickly dive into 3 powerful insights from the course. First, don't overlook autoimmune diseases when evaluating chest pain. Pericarditis in lupus, myocarditis in dermatomyositis, even pulmonary embolism in antiphospholipid syndrome. These are high-yield, board-relevant, and can save lives. Second, rheumatologic lab panels aren't just about ANA positivity. This course teaches you how to interpret patterns, like a positive anti-RNP pointing toward MCTD or anti-CCP indicating aggressive rheumatoid arthritis. You'll stop memorizing and start understanding. Third, treatment pearls that go beyond the basics. Did you know that methotrexate isn't just a first line for RA, but also helps reduce cardiovascular risks in these patients? Or that hydroxychloroquine's retinal toxicity risk doubles after 5 years? This isn't textbook trivia. It's the stuff that gets asked in board vignettes and pimp questions on rounds. If you want a rock-solid grasp of rheumatology for the boards, your rotations, or your first year as a resident, this review is your shortcut. Want the full PDF or course content? Click the link in the description to access the complete Brigham Review in Rheumatology. Download it today and level up your clinical game. And hey, don't forget to like, share, and subscribe so you never miss high-yield breakdowns like this.